Hello. Today we're going to be covering the Hypervolt. It's a unit we use in clinic quite a bit. We find it's very good for increasing circulation, giving good myofascial release prior and post treatment to really loosen those muscles and get them ready for the therapy, whether it be activation, local motor control, or even the myofascial strengthening. Matt is going to show the Hypervolt in action with some of the different tips we have. Matt.
How's it going? So we use the Hypervolt a lot in the clinic. So I'm going to be demonstrating it and what we use it for, and also some different heads that it comes with. So a lot of our patients, they come in, they have tight traps. So we can go to work right away, usually on level 1, flat head, on the traps. Spend a little time there just to start getting those to relax a little bit. So for demonstration purposes, I'm not going to spend as long as I would on a normal treatment. But so we get in here with the flat head, get it relaxed a little bit, and find a little knot, find a little tight spot. Shut it down. This is just a demo of our bullet tip. Switch out the flat head. Might have a little spot we need to work on a little more in that trap. Cut that baby back on and just dig in right on that spot.
The varying tips allows us to work on different areas of tissue. So Matt is using the finer, more for trigger point head, and we find that really gets those knots out really well, like he's demonstrating with Greg right now. He also has other heads for other parts of the body, whether they be bony or just kind of tight, or really meaty parts like say the glute or the hamstring. A lot of athletes are using these now for recovery, and that's why one of the reasons we started selling them in clinic. They're really good post-exercise to reduce inflammation. It's a very versatile unit, and it's pretty powerful and lightweight.
Another head we use a lot of is the rubber tip head. It's pretty forgiving, so we like to incorporate this with if we need a Hypervolt around a joint or a bony area. We mostly want to stick to the muscle when you run this gun. Let's say if you want a little more power, you can cut it up, level 2, and you can run right over that acromion. You're not going to worry about it skipping off a bone or causing any pain there. And especially if you want to get deep in that joint, just kind of hold some sustained pressure. It does a really good job letting that whole area get some circulation in it.
For patients without the sensitivity issues, you can go directly over the skin, but you can also still go over clothing as well. And it's just going to give a more direct feedback and a deeper push with the percussion head.
Let's say what we use this machine for the most is definitely the paraspinals. Patients come in with a lot of back pain sometimes. They're real sensitive. Sometimes they can't handle this, but it's definitely always a goal to build them up to be able to handle the Hypervolt. And a lot of our patients, like Dennis was saying, they might come in with some acute pain, or it might be more chronic pain, but it's definitely a go-to 5-10 minute treatment with our back pain patients, and it's pretty effective.
Yeah, and also like Matt was alluding to, sometimes they're very sensitive to the Hypervolt, and this will actually break up that sensitivity. A lot of pain and sensitivity kind of go hand in hand, and even if they can't handle the flat or the rubber tip, we can put more padding down, like a towel or hot pack cover, something like that, and it'll really let us work on that tissue in a pain-free way.
Fork head. It's good for the gastrocs, good for the hamstrings, and you can go through some active release or some contract relax, some reciprocal inhibition, stretches here. And that fork really kind of gets in between the heads of the different hamstring muscles, and you can dig in, get it to relax a little bit.
Yeah, the fork works really good with a lot of the, like Matt was saying, the heavy tissue areas, glutes, hamstring, quads, and just really saves time with our sessions on how fast we can treat someone, and we can cover a large part of their body very quickly. before the Hypervolt, we were having to use hands, fingers a lot for these releases, and by the end of the day, you know, your hands are pretty tired, and so isn't all good for therapists, but really anyone who has any pain issues, they're able to very quickly address an issue directly, and then they get the relief and they don't have to wear out their hands or fingers.
For more information about the Hypervolt, go to our website, functionfirstla.com.